Immediate newborn care.
Hello, good morning. My name is Counselor Missy Kaime from BSN 12F, and today I will be performing immediate newborn care. And immediate newborn care is the care given to the neonate after birth by qualified personnel in the delivery room. So first is we are going to wash our hands and prepare the needed materials. This is to deter the spread of microorganisms and to save time and energy. So we have the materials included are basins, working gloves, sterile gloves, operating sponge with alcohol and sterile gauze, vitamin K, alcohol, thermometer, cord clip, syringe, ophthalmic ointment, and a scissor. And the next is we are going to properly identify the infant through name band or wristband. This is to prevent error and harm to the newborn. So this is the wristband of the baby. And now that we have identified the baby, we are going to enhance infant's comfort by keeping the environment warm. This is to prevent the risk of hypothermia. So, just going to adjust the temperature of the aircon. Alright. So next is we are going to wash our hands before putting on working gloves. So now that we are done with washing our hands, we can just perform hand hygiene. This is also to prevent the spread of microorganisms. So next is we are going to wear the gloves. Now is we are going to weigh the newborn correctly. This is to identify those who are at risk of health problem associated with their weight. So I have already weighed the clamp on the umbilical cord of the baby, so I am just going to subtract it with the weight of the baby. Okay, so after doing that is we are going to proceed with the cord dressing. So first is we are going to discard these working gloves and put on the sterile gloves. This is to protect us from any discharges. So we are going to put our sterile gloves, but before that we are going to perform hand hygiene again. So next is we are going to properly restrain the upper and lower extremities of the newborn. So using operating sponge with soak in alcohol, we are going to disinfect the cord 3 times from base upward. Then discard it in the basin in the next. And then now is we are going to place the sterile operating sponge at the base of the cord and clamp the cord with umbilical clip 1/2 inch from the base of the cord. So we are going to put the cord clip 1/2 inch from the cord and then cut it. And then discard. And then now is we are going to place operating sponge at the base of the cord and then stamp and pour 70% alcohol over the cord. And the next is we are going to proceed in injecting vitamin K to the baby. This first is we are going to withdraw the exact amount of vitamin K from the ampule and inject it into the middle third lateral aspect of the infant's thigh. So this will help prevent rare bleeding disorder called hemorrhagic disease of the newborn. After injecting the vitamin K to the baby, we are going to discard this syringe in the hazardous materials. And the next is we are going to carefully get the anthropometric measurement of the newborn, starting with the head circumference, the chest circumference, the abdomen circumference, and lastly is the newborn's length. So we are going to use our tape measure to measure the head circumference of the baby. So head circumference is slightly larger than chest markovely if it is reversed. So we are going to use the centimeter of the tape measure in measuring the head circumference of the baby. Okay, it is 31 centimeter, and then in the chest circumference is 27 centimeter. Centimeter. And the length of the newborn is 38 centimeter. So now is we are going to take the newborn's temperature rectally. This method is accurate and gives a quick reading of the baby's internal temperature. Okay, so it is 37 degrees Celsius. And next is we are going to do the initial bath of the baby. First is we are going to hold the baby in a football grip manner, holding both ears. This is to prevent water from entering the ears. So now we are going to carefully wash the newborn's head with the use of baby soap or mild shampoo and wipes dry thereafter. We have to keep in mind that the fontanelles of the infant are not yet fully developed. Now we have to wipe the head of the infant. And then since my glove is already wet, I am going to discard this and use another working glove. And then now is we are going to put the newborn's diaper, shirt, mittens, and booties. going to wrap the newborn securely with clean blanket. This will warm the baby, mittens, prevent baby from unintentional scratching. And now we are going to place the newborn in the crib with drop light on the attachment top. So luminance coming from the drop light can actually help the baby being warm. So we are going to turn on the drop light. And then now we are going to apply Crates prophylaxis. So shades newborn eyes from light and open one eye at a time by exerting gentle pressure on the upper and lower lids. So infants' face are delicate and does not contain that much strength to feel hard pressure. So now is we are going to apply ophthalmic ointment from the inner to the outer contus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So this will protect the baby from getting bacterial eye infection that occur during birth. So we are going to apply gentle pressure, and then from inner contus to the outer contus, and to the other side. From inner contus to the outer. Alright? And the next is we are going to take the newborn vital sign such as the fetal heart rate and the respiratory rate. So this will provide baseline data when the if the patient is healthy. So we are going to use this bell part of our stethoscope and find the apical pulse of the baby. Okay, it is 140 beats per minute. And then in the respiratory rate of the baby, we can just observe the rising and fall of the chest of the baby. And if it is too hard for you to observe, you can just put your 2 fingers in the abdomen of the baby and feel the rising and fall of the stomach or the abdomen. Okay. So now we have to do aftercare of the equipment used. This will prevent displacement of the materials and promote orderliness. So first is we're going to discard these working gloves. And so now after care of the equipments, we are going to record the procedure done and other pertinent data. This is an important information about the infant and it will enhance effective communication among healthcare teams. So in the documentation, we have gotten the weight of the infant, which is 3.5 kg, the fetal heart rate of the baby, which is 140 beats per minute, and the respiratory rate, which is 23 counts per minute, and the temperature is 37 degrees Celsius, the head circumference is 31 centimeter, while the chest circumference is 28 centimeter, the abdomen circumference is 27 centimeter, and the newborn's length is 38 centimeter. So next thing and the last thing we need to do is to answer related questions of the procedure. This will enhance right endorsement and maintaining the accuracy of the data. So that's all. Thank you.